Hi, I'm Dr. Edwin Williams, a rhinoplasty specialist. I'm here to answer your questions today, and one of the questions I get all the time from my patients is, will they have to break my nose? Meaning, will you have to break my nose when you do rhinoplasty? It's a very common question that I get. Let me explain a little bit about the answer to that question. First of all, the nose itself is made up of soft tissue, cartilage, and bone. And the bone is up here. In fact, we tend to think of our nose being, if it's big, being a lot of bone, but in reality, most of it is cartilage. So the upper part up here that is firm is bone. So what does it mean to break the nose? Now, people have these connotations of large hammers and chisels because they've heard this from horror stories from years ago. But for those of you who are old enough to remember what postage stamps look like with little perforations in them, this is how I kind of fracture the bone when I need to fracture the bone. I have a very small instrument called an osteotome. It's 2 to 3 millimeters, which is this big. And we just put little tiny perforations in the bone and then move it. And that's how we fracture the bone. And it's much less traumatic than the older methods of fracturing the bone. But the question is, do we really need to do it? And I usually say most of the time we do. And the reason why is this: if the nose is off or crooked a little, we don't want to just straighten out the cartilage part without straightening out the bone part. We want the same width from top to bottom so that it looks much more symmetrical. The same thing goes when we take down a bump. Sometimes when we take down a little bump, we don't need to do anything to reposition the bones. But if we take down a big bump, we do need to bring those in so we have the same width from top to bottom, which looks much more aesthetically pleasing. So there are a couple different approaches we use, and we're big fans of the closed or endonasal approach, or some people refer to it as the scarless approach. And what we're able to do is to do this if we have to reposition that bone through the inside of the nose without making that incision across the base. I have a YouTube video out there about how I put a dressing on the nose and split the nose to show what someone is like at 1 week with the amount of bruising. So you can kind of get a feel, because there's a lot less bruising when we use this closed or endonasal approach. So I hope that answers your questions about, do we need to break the nose in rhinoplasty? Not all the time. A lot of the times we do, but done in a very controlled fashion, has very little bruising. All the other questions we have in a book here, Rhinoplasty, I wrote. It's called Everything You Need to Know About Fixing and Reshaping Your Nose. It's available on Amazon. The proceeds go to domestic violence. I hope you found this interesting, and thanks for taking the time to watch.